Diabetes mellitus, centuries of struggle and unquenchable hope. Since early childhood, American Edwin Smith was fascinated by everything connected with ancient Egypt. Pyramids, ancient scrolls, mummies, wall writings. All this tirelessly attracted him. It is not surprising that, having matured, the young man decided to move to Egypt, so he could go deep into the study of the history and culture of this country. Edwin paid special attention to the search for antiquities, which he carefully kept in his personal collection. In 1962, Edwin Smith, at the age of 40, acquired a papyrus published around 1550 BC in Luxor, a city on the east bank of the Nile. Lacking the knowledge to read the scroll and without considering its proper value, Edwin decides to resell it. The German Egyptologist George Ebers becomes the new owner of the find. Being an experienced papyrologist, he was excellent at reading ancient Egyptian texts. Unfolding a scroll with trembling hands, the length of which was more than 20 meters, George Ebers was profoundly delighted. He had the oldest known surviving manuscript in front of him. Moreover, it was a text of medical content. Later named in honor of the German scientist, the Ebers papyrus contains a description of a wide variety of diseases, methods for diagnosing them, and methods of treatment. During the reign of Amenhotep I, circa 1536 BC, the ancient Egyptians already knew about traumatology, parasite control, gynecology, and false teeth. In 108 columns of this medical treatise, recipes for the preparation of a wide variety of medicines made on the basis of milk, honey, and beer are set out. Magic formulas are also presented here, which should contribute to a speedy recovery. As early as 3,500 years ago, the ancient Egyptians had a full understanding of various nervous diseases, including depression and migraine, which were called the disease of half of the head. They also knew about diabetes. The Egyptians described it as a pathological condition, which is accompanied by a large amount of excreted urine. As it turned out, in ancient Egypt, people were perfectly able to diagnose this disease, but, unfortunately, they had no methods of treating it. A person properly diagnosed was doomed to certain death, which was not long in coming. Diabetes mellitus tirelessly accompanies humanity at all stages of its development. It is accompanied by frequent urination, unusually strong thirst, and weight loss. The very concept of diabetes was first used by the Greek physician Demetrius of Apamea, who lived in the 2nd century BC. This word was not chosen by chance, since it means to pass through, translated from ancient Greek. Thus, the doctor described how the disease was perceived in those days. Water is absorbed by a person in large quantities, but immediately passes through a body, almost without lingering in it. Finally, the term diabetes was approved by Areteus of Cappadocia. This talented ancient Roman physician lived in the 1st century AD. At that time, only the most primitive methods of examining a patient were available to him. He could palpate internal organs through the abdomen and also measure body temperature, respiration rate, and pulse. The doctor also paid attention to the color of the skin, the pupil's condition, and the discharge of the patient. Nevertheless, even such limited diagnostic capabilities allowed Areteus to make amazing discoveries in psychiatry, endocrinology, and other areas of medicine. In his writings, he describes epilepsy, dementia, and, of course, diabetes in detail. The fluid does not remain in the body, using it as a ladder in order to leave it as soon as possible, Areteus wrote in his medical treatises. This was the idea of diabetes that the doctors of that time had. They perceived the disease as a condition in which a person ceaselessly loses fluid. The loss of the ability to retain fluid inside the body was also explained by the excessive thinness of diabetics. Diabetes is a terrible suffering, Areteus goes on in his notes, dissolving flesh and limbs into urine. Patients constantly excrete water in a continuous stream, as through open water pipes. Life is short, unpleasant, and painful. Thirst is insatiable. Fluid intake is excessive. Over the following years, views on diabetes remained virtually unchanged, until the Swiss physician and alchemist Paracelsus, in the first half of the 16th century, critically questioning the ideas of ancient medicine, suggested that the cause of the disease could be an excessive amount of salt in the human body. To some extent, he was moving in the right direction in his reasoning, but not completely. As early as 150 years after Paracelsus' medical search, the English physician Matthew Dobson refuted the assumption of his predecessor. Full of curiosity, as expected from a doctor, he studied the urine of people with diabetes and noticed that after a while, a white sediment began to collect at the bottom of the container with liquid. Further research by Matthew Dobson found that the urine of such patients had a sweet taste. Since then, the disease has acquired its full name, diabetes mellitus. We use it to this day. It took several decades before doctors figured out that the white sediment at the bottom of the urine container was glucose. Immediately after that, they moved to a new level. They learned to measure the level of glucose in the urine. It was the British scientist and physician Thomas Willis who made some refinements to the research of his colleague Matthew Dobson. In 1675, he published the results of studies, according to which the urine of diabetic patients can be of two types, sweet and tasteless. So, besides diabetes, such a thing as diabetes insipidus appeared. Later, scientists learned that this disease is a pathological condition associated with impaired functioning of the kidneys or pituitary gland. That is, it has practically nothing to do with diabetes mellitus. In fact, Thomas Willis discovered a new disease, although then he quickly lost interest in his discovery. Instead, he devoted time and effort to inventing his own opium tincture. With this tincture, Thomas Willis treated gout, kidney stones, convulsions, colic, vomiting, pleuritis, and respiratory diseases. He believed that opium overcomes fever and promotes good and sound sleep. At the same time, the doctor urged to use the tincture quite deliberately and in no case increase the dose of the drug taken. Meanwhile, scientists continued to work on finding the causes of diabetes. Technologies gradually developed, and soon it became possible to determine the glucose concentration not only in urine, but also in blood serum. The researchers paid attention to the fact that at first the level of sugar rises in the blood, and only after a while begins to rise in the urine. This discovery led them to dismiss the notion that diabetes is caused by the inability of the kidneys to retain sugar. Anyway, the disease, apparently, has nothing to do with the kidneys. Instead of the sugar incontinence model, they switched to the elevated sugar model. Sometimes the paths of researchers and doctors are filled with innocent victims. In most cases, these victims are pets whose lives have been sacrificed on the altar of medicine. Thanks to experiments on animals, they could diagnose new diseases, test medicines, get acquainted with the work of internal organs. The ethics of such research can be debated for a long time, but their benefit to mankind, of course, is undeniable. German physician and part-time professor at the University of Breslau, Oskar Minkowski, conducted medical experiments on dogs. In those days, it was possible to learn about the role of one or another organ only by removing it from an experimental animal and following its further state. Oskar's colleague, another well-known physician of his time, Joseph von Mering, at that time was strongly fascinated by the desire to investigate the main functions of the pancreas. He wondered what exactly this comma-shaped organ, which was located between the stomach and small intestine, was responsible for in the body. Neither Oskar Minkowski nor Joseph von Mering was interested in diabetes at all, and all their research was built exclusively around the pancreas. However, of course, being doctors, they were well aware of such a disease, and were aware of its symptoms and course. On a hot summer day in 1889, they decided to remove this organ from an experimental dog. The operation was personally performed by Oskar Minkowski. Upon its completion, the doctors began to observe the operated animal in the hope of noticing imminent changes in its behavior and condition. They had not long to wait. During the night, the dog excreted a large amount of urine. on which flies began to flock due to the high content of sugar in it. Scientists have guessed that this is a symptom of diabetes. When they tested the dog's urine, they indeed found high levels of glucose in it. Their suspicions were confirmed. The link between the pancreas and diabetes was undeniable. It was this organ that contained the regulators that made it possible to control the level of blood sugar. Previously, no one associated the disease with impaired pancreatic function. Therefore, the work of Oskar Minkowski and Joseph von Mering had a great influence on other scientists who continued their research in a new direction. For his achievements in medicine, Oskar Minkowski later was depicted on postage stamps, and thousands of people could look at this neatly trimmed elderly man in thin-rimmed glasses for whom the passion for knowledge had always been in the first place. Research continued. By studying the pancreas in detail, physicians have found that it contains different cells that differ from each other based on the functions they perform. So, exocrine cells produce digestive enzymes, and endocrine cells secrete hormones into the blood. Clusters of endocrine cells were named islets of Langerhans, in honor of the German scientist Paul Langerhans. Even in the previous century, he discovered these stellate bodies that conduct nerve impulses, although at that time neither he nor other scientists even knew about their immunological function. The substance secreted by the islets of Langerhans will later be called insulin. Translated from Latin, the word meant island. Scientists understood that the only way to help a person with diabetes was to support his body with insulin obtained from outside. But how could this be done? Doctors removed the pancreas from dogs, crushed it, and fed it to their patients. But this did not give any results. In the process of their manipulations, the contents of the endocrine cells mixed with the digestive enzymes of the exocrine cells, and as a result were destroyed. There was no way to isolate the islets of Langerhans, until a young Canadian physician named Frederick Grant Banting became interested in the issue in 1921. The fact that Frederick would imprint his name in history was not in doubt among any of his contemporaries. He was too bright and memorable a personality. Frederick skillfully combined a passion for science with a passion for art. The only time he took a brief break from his medical studies was to take part in an artistic expedition around the Arctic Circle. Clean-shaven and meticulously combed, Frederick Banting achieved success in any business, no matter what he undertook. After starting his theology studies at the University of Toronto, he soon changed his mind and decided to become a physician. After having received a bachelor's degree, he went to France to help soldiers during the First World War. Frederick Banting went through the whole war, was wounded in Portugal, and then awarded the Military Cross for heroism. After World War I ended, he returned to Canada and continued his medical practice. He was interested in orthopedics and pharmacology until he accidentally came across the work of Oskar Minkowski on diabetes research. Frederick was fascinated. He soaked himself in the subject. He learned that the disease is caused by a lack of the peptide hormone insulin, which is secreted by Langerhans cells located in the tail of the pancreas. He got acquainted with the attempts of doctors to restore the lack of this hormone in their patients. First, the medics gave diabetic sufferers fresh canine pancreas, then its extracts. But all their attempts have failed. Each time the hormone was dissolved before it entered the patient's body. Frederick Banting pondered this problem for a long time. There must be a solution, he told himself. The answer was right on the surface. You just need to see it, to notice. And so it was. One day, carried away by his thoughts, Frederick leafed through a medical magazine, getting acquainted with the new theories and achievements of his colleagues. Suddenly, his eyes fell on an article on pancreatic research. The author of the article, American physician Moses Barron, described a clinical case when the pancreatic ducts were clogged with stones. As a result, the trypsin-producing cells of this organ succumbed to destruction, while the cells of Langerhans retained their integrity. The young scientist froze with a medical magazine in his numb hands. The blood pounded loudly in his ears. The problem could be solved. The problem should be solved. It was solved by ligation of the pancreatic ducts. The answer was really obvious. It was only necessary to see it, to compare various facts, to find connections between the results of different studies. All that remained was to confirm his guess experimentally. With this, Frederick Banting had no problems either. One of his fellow scientists, with whom Frederick was quick to share his insights, suggested using his laboratory for experimental work. This scientist was John James Rickard MacLeod, a professor at the University of Toronto. John MacLeod had been interested in diabetes for a long time. Over the past 15 years, he never abandoned his desire to learn how to isolate the substance, the lack of which provokes disease development in the body. MacLeod closely followed the research of other scientists who were constantly coming up with new ways to make extracts from the pancreas. Work in this direction was constantly carried out, but no one achieved any result. When MacLeod heard about Banting's forthcoming experiments, he began to hope that this time the young scientist would really beat the odds. For his part, he was ready to help and assist Frederick in every way possible. First, he possessed exhaustive knowledge in this area. Secondly, he had all the equipment necessary for the experiments at his disposal. Furthermore, John MacLeod believed in Frederick's forthcoming discovery so strongly that, except for the laboratory, equipment, and his own help, he also made available his own assistant, the talented young man Charles Best. The main scientist's concern was formulated by Frederick in the following words: ligate the pancreatic ducts in a dog, wait 6 to 8 weeks, remove the pancreas, and extract it. Within a couple months of experimentation, they managed to isolate insulin that was not destroyed. An extract showing the desired activity was also isolated from the embryonic pancreas, since food enzymes have not yet been produced there in the required amount. It was necessary to make sure that the new substance was not dangerous for humans. Frederick Banting, John MacLeod, and Charles Best took turns injecting themselves with insulin. No one's health condition has changed drastically. The next step was to make sure that the pancreatic extract really has a positive effect on diabetic patients. To do this, the scientists had to remove the dog's pancreas once again so that it developed diabetes. The dog, which had fallen into a diabetic coma, was then injected with an extract from the pancreas of another animal. Frederick Banting and Charles Best could not help showing their emotions. For the first time in history, a diabetic coma did not end in death. Never before has anyone been able to get out of it. However, the dog really came to its senses for a while. It was an event of colossal scale. Now it was necessary to test insulin in humans. Frederick began to look for those who would agree to such an experiment. The search was not difficult. The course of diabetes mellitus, as a rule, was so rapid that neither the sick themselves nor their relatives had actually nothing to lose. Banting's first patient was a 14-year-old Toronto boy named Leonard Thompson. The boy was already in a diabetic coma, and his parents resigned themselves to the imminent death of their child. When approached by Frederick Banting, they agreed to an experimental treatment. The experiments of the scientist gave them a chance, though remote. When Banting first saw the immobile Leonard, he shuddered involuntarily. The boy was excessively thin and exhausted. At 14, he barely weighed 29 kilograms. This was not surprising. At that time, the only cure for diabetes was fasting. If the patient refused food, the blood sugar did not rise. This gave chances to prolong life, at least for a while, at least for a few months. The scientist bent over the child and took out instruments for injection. The insulin looked like thick brown goo. The doctors had to try hard to get the metal needle of the syringe into the thinned veins of the child and give an injection. The boy was injected with the preparation, as they previously administered it to the experimental animal. But there were no positive changes in Leonard's well-being. On the contrary, after a while, it only got worse. The child developed an allergic reaction. Scientists guessed that it was caused by a foreign protein that his body could not cope with. They needed to find a way to purify the medicine. Without wasting a second, John McLeod turned to the biochemist James Collip for help. His request was to purify insulin from the slightest impurities. James Collip did an excellent job with the task assigned to him. He purified the extract and presented it to the doctors in a form that made it suitable for further clinical use. Then Collip became an integral part of the team himself. He worked tirelessly to find ways to isolate the extract, not only of high purity, but also in large quantities. The purified insulin was injected into Leonard again. This time the boy began to come to his senses. He became the first patient who was saved from death thanks to the pancreas extract. After these events, Leonard lived for about 13 years, but then he died of pneumonia. Unfortunately, the struggle with diabetes has exhausted his body and reduced his ability to resist other diseases. However, the very fact that Leonard was able to wake up from a coma and diabetes was no longer a threat to his life was a real discovery. Leonard Thompson became a sensation. After that, Frederick Banting decided to share the results of his research with the medical community. He went to Connecticut, where he made a presentation before the medical board of the university. During the performance, he was worried and therefore stuttered a little. He was short of the time allotted for the report to be able to talk about his achievements in detail. Nevertheless, what the young doctor said was enough to make a splash in medical circles. Frederick returned from Connecticut to Toronto, and along with Charles Best, John McLeod, and James Collip, they continued their research. Their second patient was Banting's classmate, Joe Gilchrist. Joe became ill with diabetes during World War I. Over the next 5 years, he diligently fought the disease. He was on starvation diet and forced himself to regularly go for walks so that the body would at least partially burn the released sugar. In October 1921, Joe was caught in the rain and developed pneumonia. For a diabetic, this was akin to a death sentence. His condition worsened so much that even 100 grams of any food immediately raised his blood sugar level. Tormented by hunger, Joe Gilchrist refused any food. Being a physician, he knew that if he ate just a bite, he would fall into a diabetic coma. By February, when Joe Gilchrist finally arrived at Banting's lab, he looked more like a skeleton than a living person. The smell of acetone emanating from him filled the room. He didn't really believe that his friend's research could save him, but he was ready to try. Frederick handed Joe 30 grams of pure glucose for him to swallow, then held the spirometer to his friend's lips. The world went dark before Joe Gilchrist's eyes. Instead of starting to burn the given sugar, his body continued to burn its own fats and proteins. In other words, it ate itself. Suddenly, Joe felt a prick. He was injected with insulin. The doctors were silent, waiting for the result. It would seem that there were no changes. The spirometer was brought to Joe's lips again. The medical device showed that the volume of air released from his lungs had increased. Joe also felt that his breathing became easier. The blackness before his eyes receded. Banting's speech before the Connecticut Medical Council, meanwhile, bore fruit. The news of his life-saving discovery spread among doctors and patients alike. People streamed into Frederick Banting as their last hope for salvation from a disease that was slowly killing them or their loved ones. Frederick never refused to help. Geneva Stickelberger fell ill at the age of 9. The disease progressed rapidly, but her mother, Josephine Stickelberger, did not give up and continued to look for opportunities to save her daughter. When information about the experiments conducted by Banting reached Josephine, she immediately called the scientist, and he invited them for treatment. 10-year-old Geneva was taken by her mother to Toronto by train. Josephine looked at her daughter's thin face, and her heart sank. The girl's condition worsened every minute. Right in the arms of her mother, she fell into a diabetic coma. Josephine rushed to the train driver, asking him to contact the hospital and Dr. Banting. The frightened machinist started to comply with her request. Josephine stroked her daughter's hair and prayed that the train would arrive on time. She listened to the rhythmic clatter of the train wheels and grew desperate. Life gradually left her daughter. Why are they going so slowly? The breath of Geneva was barely guessed. It seemed like time had stopped. When the train finally arrived at the station in Toronto, Frederick Banting and his assistants were already there. The doctor gave Geneva the first injection of insulin right on the platform. To the sound of the steam produced by the locomotive, to the astonished glances of the crowd, Geneva came round in the arms of a tearful mother. The girl, saved that day, grew up and lived a long and happy life. She worked as an accountant for an oil company and had friends and family. She died at the age of 72, having lived 62 years longer than she was originally destined by fate. Throughout this time, insulin injections kept her alive. Grateful mother Josephine Stickelberger, being a doctor by profession, continued to keep in touch with Banting, assisting him in his research whenever possible. It was she who helped the scientist with the determination of the correct dosages of insulin. After that, the use of the medicine became even more effective. Following the results of his work, Banting wrote his doctorate thesis and received an MD from the University of Toronto. At the same university, a Department of Medical Research named after Banting and Best was established. The scientists who took part in the isolation of the pancreas extract became famous. And although the idea that gave rise to fundamental research belonged only to Frederick Banting, he could not have achieved anything without the laboratory, equipment, assistance, and support of John MacLeod. The help of Charles Best and James Collip was also invaluable, with each of them have made tremendous efforts to ensure that the cure was actually invented. In 1923, Frederick Banting and John MacLeod were awarded the Nobel Prize in Physiology or Medicine for their discovery of insulin. However, the scientists were outraged that not all members of their team were among the laureates. At first, Frederick even thought of refusing the prize. If Charles Best worked on a par with him, his reward should be commensurate. After a while, Banting nevertheless heeded a piece of advice from his friends and colleagues not to refuse the award. So he just divided the money he received equally between himself and Best, and then officially announced the immeasurable contribution of the latter to the discovery of insulin. John MacLeod did the same, sharing his prize with James Collip. Time passed, and the members of the Nobel Committee admitted their mistake. Best really should have been among those awarded. Further research activities of the young man gave them the opportunity to give him his due more than once. In subsequent years, Charles Best was nominated for the Nobel Prize 11 times. As for the path of Frederick Banting, he continued working as a member of a wide variety of medical communities, worked on the problems of cancer and silicosis, and studied the processes of drowning and circulatory disorders in pilots. When World War II began, scientists regularly visited the UK to provide communication between British and North American medical institutions. During one of these visits, Frederick tragically died in a plane crash. At the time of his death, he was only 49 years old. Frederick Banting's achievements in various fields of science are undeniable, but his contribution to the treatment of diabetes mellitus cannot be measured. No wonder that in recognition of the scientist's merits, World Diabetes Day is celebrated exactly on his birthday, November 14th. The discovery of the inquisitive man has provided physicians with the opportunity to save the lives of people who were previously considered incurable. Now scientists faced a new challenge: to make insulin available to a wide range of patients. Mass production technique was required. An American soldier, pharmacist, chemist, and businessman, Eli Lilly, decided to take on this business in America. In 1876, Colonel Lilly founded his own pharmaceutical company in Indianapolis, which made drugs and sold them on a wholesale basis to pharmacies. It was Eli Lilly's company that was the first in the world to produce medicines inside gelatin capsules. This brought the company tremendous success. Lilly's company quickly grew into one of the largest pharmaceutical companies in the world, and all thanks to constant research and developments, high quality, and standardization of the medicine release. The company took up the development of technology for the mass production of insulin almost immediately, as soon as a question arose. The process was set up quite quickly. The equipment necessary for the production of insulin in large quantities was ready by the spring of 1923. As early as on October 15th of the same year, the world saw the first medication containing insulin of animal origin. It was named Ileden. Except for the United States, other countries also sought to produce insulin. The United Kingdom was one of the first countries to receive a permit. Others were ready to follow. "Don't you think we should go to Toronto?" the Danish scientist August Krog's wife Marie once asked, "to find out if Denmark can get the required authorization?" August Krog, the winner of the 1920 Nobel Prize in Physiology or Medicine, looked up at his wife. He always listened to her, relying on her sharp mind and well-developed intuition in almost all matters. It was the same this time. Her suggestion sounded simple and logical, even though its implementation required a lot of effort. The fact that August Krog was involved in completely different branches of medicine. He studied the role of capillaries in regulating blood flow during exercise. He received the Nobel Prize for discoveries in this area. Although his interest in the possibilities of treating diabetes mellitus arose for personal reasons. His wife Marie was recently diagnosed with this disease. August loved his wife very much. He looked at her slightly sunken face and realized that he would produce a cure for diabetes no matter what. On the same day, August Krog wrote a letter to one of the inventors of insulin, John MacLeod. "I do hope that it will be possible to grant Denmark the privilege of participating in the work of developing this incredible new discovery," he mentioned in his letter. He feared that his request would be denied, or worse, ignored. But MacLeod did not refuse his colleague. The ambition to fight illnesses and help others was incredibly strong in him. If it were not for this drive, it is likely that insulin would not have come out in Toronto in those years. Without the slightest hesitation, John MacLeod invited August and Marie to Toronto and even declared that he would personally provide their comfort. During their visit, the Danish physiologist and his wife stayed at John MacLeod's place. The Canadian doctor introduced them to other scientists working on the development of diabetes medicine and even invited August to give a lecture on capillaries at the University of Toronto. In the process of their communication, Krog and MacLeod quickly found a common language, and therefore John, without thinking twice, granted permission to the Danish scientists to produce insulin in the Scandinavian countries. Back in Copenhagen, the Krogs immediately started looking for funding. They didn't have time to apply and wait for the Danish government to approve it. Instead, they contacted the management of a private pharmaceutical, Loven Chemical Company, and offered a partnership to the company's owner, August Kongsted. Kongsted agreed to take part in the release of a new medicine, but only if the drug would be called Insulin Leo, which means lion in Danish. August Kongsted really liked that sound. August Krog began developing insulin with Dr. Hans Christian Hagedorn, a young diabetes specialist and friend of Marie, who had diagnosed her with the disease a year earlier. They worked alternately at Krog's Institute and at Hagedorn's home until they got their first dose of the drug, extracted from the pancreas of a bull. The results were so encouraging that the scientists decided to fully focus on the production of insulin. In the spring of 1923, Krog, Kongsted, and Hagedorn founded their own laboratory for the production of this medication. As early as a year later, the laboratory grew and turned into the Nordisk Company, managed by all three scientists on equal terms. Insulin Leo was produced not as a solution for injections, but in the form of tablets. This greatly simplified and facilitated its transportation and storage. In hospitals, these tablets were dissolved in a clear fluid and then administered to patients. The company grew, and Danish insulin quickly reached the world production level. Nordisk's greatest strength has been the talented and dedicated professionals who have worked non-stop to improve the formulation and ease of medicine use. One such specialist was an electrical engineer named Harold Pedersen. He was the author of a machine for the mass production of insulin. This machine cut the frozen pancreas into thin pieces that immediately fell into cold acidic alcohol, which accelerated the insulin extraction. When Crow needed an experienced chemist in the autumn of 1923, Harold brought his brother Thorwald to the company as well. When the need arose to standardize insulin, Harold recommended his daughter for the job. It would seem that by combining joint efforts, Nordisk could easily reach any heights. But instead, a misunderstanding arose between Hans Christian Hagedorn and Thorwald Pedersen that quickly escalated into a quarrel, which further turned into an irresolvable conflict. The Pedersen family decided to leave Nordisk and start their own. Possessing all the knowledge and technologies necessary for the release of insulin, they took on producing the medication on their own. The first insulin they produced was named Novo, which contrasted it with the medication manufactured by Nordisk Pharmacology. The name of the company founded by the Pedersens was also appropriate, Novo Therapeutisk Laboratorium. So, two irreconcilable competitors have appeared in the European insulin market, which has not yet been fully formed. The constant competition made them grow and develop, keeping on presenting the world with more and more new developments in the field of combating diabetes. Thus, in 1946, a way was found to prolong the action of insulin. This increased the intervals between injections and significantly reduced their total number. In the 1970s, scientists invented a portable glucometer that made it possible for patients to self-monitor their blood glucose levels. Using simple and convenient test strips, people suffering from diabetes could monitor their condition at home. In 1985, the world saw the first syringe pen for insulin injections. With its advent, there was no need for uncomfortable glass syringes for injection. With the help of the syringe pen, diabetic patients could easily administer the required dose of insulin to themselves. Nordisk and Novo have been fighting for both Danish and global markets for long 50 years. Nordisk focused on new developments, while Novo on effective marketing. Although in January 1989, these two largest companies were tired of half a century of struggle and decided to merge again. This is how the renewed company Novo Nordisk AS appeared, which to this day effectively resists diabetes. Unfortunately, neither Crow and Hagedorn nor the Pedersen brothers have seen this. The fight against diabetes is underway. Every day, scientists from Novo Nordisk AS, Lilly, and other pharmaceutical companies are working to improve the current form of insulin. Among their latest developments are glucose-sensitive and cardioprotective insulins, as well as insulin which can be administered no more than once a week. Work is also ongoing on the laboratory cultivation of pancreatic cells based on stem cells. The artificial part of the pancreas can then be implanted into the human body. It is assumed that placed in the body of the patient, it activates the production of insulin by their body again. Today, scientists are looking for a way not only to facilitate the treatment of diabetes, but also to completely cure this disease, and then to make the new medicine available to the general public. Day by day, they turn their focus and efforts toward this goal. And, without a doubt, the day will soon come when they will be able to achieve what they desire. Sincerely yours, Dr. PopMed.